Hi everyone, Dr. Timothy Gallagher here again at Maragal Medical. Over the last several months, you've had an opportunity to learn about all of the exciting treatment options that we have available at our integrated medical clinic. If you've ever been diagnosed with arthritis, and if your primary care physician has now referred you to an orthopedic surgeon or a pain management anesthesiologist and has scheduled either a cortisone injection or an epidural steroid injection for the spine, you're not going to want to miss what our medical director, Dr. Michael Marciello, talks to you about in terms of alternatives to the cortisone and the epidural steroid injection. At our clinic, we utilize the latest cutting-edge treatment options that not only help you with your pain, but help to repair the destructive effect that arthritis has on your body. So stay tuned. You're not going to want to miss this one. Take it away, Dr. Mike.
Do you have options for your treatments? I certainly hope so. And if we think about medical treatments across the board, there are a lot of ways to skin the cat. We think about lots of different medications that we use to treat an infection, such as different antibiotics. There are some science, no question, to the right choices. And all of us, as we go through medical training, we try to learn the best options for your problems. But if we think about the musculoskeletal problems, the neurological issues that bring you into our clinic here at Maragal Medical, what is the most common, perhaps, is pain. What is the most common things that we see? Joint pains, neck and back pain problems. And so, do we have options for those conditions? And certainly I'm here today to try to just open your eyes to think about ways in which we do have options and we supply different things that we could do to help you make the right decision. The goal nowadays in medicine is not to tell you what to do. It's really to hopefully have an informed decision and be a joint component of your choices with our recommendations. So what do we do here at Maragal Medical that is different than a traditional standard medical practice? Well, there are a lot of things that are the same, but there's no question the options are a little more holistic. We like to think about ways in which we can take care of your pain problems, take care of you to get you functioning without needing a lot of medications. In my private practice, I have the options to do anything I want, minimize procedures, minimize medications, and hopefully maximize your function by getting you into alternative care, into choices that are not often offered to you, maybe at your other doctors or other specialists. So we think about what can we do for back pain? Well, we can all use ibuprofen. We can prescribe those medications to you, and then we just say, take this and pain will go away. Well, a lot of people don't like to use medicines. A lot of people may have gastric reflux and say, I can't take ibuprofen, it gives me terrible reflux problems. My stomach kills me, so what do I have? Okay, you'll get an offer to do a cortisone injection. Well, what if you don't like to have a cortisone? What if you don't want to go through that procedure? Are there other things to be done? Absolutely. So let's just make some basic things of which we do here, and a lot of other doctors do, but we try to keep it all together. Chiropractic care. We can do some adjustments to help you with mobilization, with adjusting the spine and moving in combination with our physical therapist, and maybe 2 days of medicine, maybe no medicine at all, and that's our goal. In my previous practice, I was writing prescriptions all the time. I was more closed-minded in ways in which we try to minimize your pain. But as we think about more holistically, we'd like to offer you different options, chiropractic adjustments, trigger point injections, which are really soft tissue muscular injections. We use a natural solution called Serapin. Some offices use lidocaine, but we avoid the cortisone. We take that away because they're more harmful, and we try to avoid harm by giving you things that are, again, less problematic. We buy time to get you through the treatment that you need to feel better again. So we get back to mobilization. We get back to laser treatments, intermittent mobilization with heating devices and deep anti-inflammatory processes, different than an anti-inflammatory medicine, could be used, such as with laser. There are many options to think about. If we go into the root of your spine problem, do you have to go to the pain clinic? Do you have to get a facet spinal injection with cortisone? Do you have to get radiofrequency ablation? Many of you may not have heard that, but it's actually using a high frequency laser to stimulate and essentially destroy the nerve ending to get rid of pain that's coming from your back. That's a little more destructive if you think about it, but why do that? Because doctors feel they don't have any other option, so they don't give you anything to choose except that ablation procedure. We could use regenerative injections, platelet-rich plasma, taking your own body's plasma, platelet-rich proteins and growth factors that may be of benefit, stem cell injections that can be instilled and injected into the same area, then rather than ablating the nerve, treating it with actually materials that could help restore function. And we're trying to reduce your pain, so we're gonna, no question, follow it up with physical therapy, conditioning, and combination of holistic treatments. I'll work with you on your nutrition, work with you on anti-inflammatory food products that actually help reduce inflammation and are more healthy for you than a long course of anti-inflammatory medicine like ibuprofen. So let's just think about when some provider wants to offer you a procedure, give you a medication, do something that you're not sure about, just ask yourself, is this what I have to do? Is this what I want to do? We here at Maragal Medical want to give you at least choices, at least some understanding that there are other options to be tried. Between chiropractic, physical therapy in combination with physiatry and physical medicine, and injections, mobilizations, and overall ways in which we think about you as a person that needs to restore function and get you back to activities without necessarily going down the road of harmful medication, prolonged course of medications that could make you dizzy or lightheaded or feel like you just don't feel right, muscle relaxers, gabapentin and neurological based medicines, long courses of different types of pain relievers. These are things that can be more problematic than helpful. I know how to prescribe them. I can certainly give them to you for short courses if needed, but let's think of other options before you go into your treatment. Give us a call. When you're in question of what to do, we can help you. See you next week.
That was great, Dr. Marciello. Wasn't that great information? I think you all now have a better understanding of what the damaging effects that cortisone and steroid injections can have on your body long term. And doesn't it make sense when it comes to treating arthritis, if you can utilize a treatment option that helps repair the damage? At our physical medicine clinic, we combine medical care, chiropractic treatment, and physical therapy all under one roof. And best yet, we take most insurances. What's exciting now as research continues on regenerative medicine, a lot of carriers, including Medicare, are now covering these injections. If you like the information you saw today, please subscribe to our YouTube channel. More information can always be found on our website at maragalmedical.com. Folks, your health is your most valuable asset, and you should be able to access that asset each and every day without limitation. Let the doctors at Maragal Medical lead you on a path to wellness. Well, that's it for today. I hope to see you again soon. Have a great day, everyone.